Petite patients often have petite belly buttons. As shown here, this patient's umbilicus is not much bigger than 1 centimeter. Postoperatively, using different techniques, we can keep that incision down to 1.5 centimeters, hiding it well within the umbilicus, but that requires not using intuitive single site port. Here's another example of another 1 centimeter incision where we avoided the single site port and used other non-traditional methods. Afterward, the incision size was no bigger than 1.5 centimeters. Patients recovered very well, and you couldn't even see an incision. Here is one non-traditional approach, using a glove over a wound protector and passing the instruments directly into the abdominal incision, thus alleviating the need for gel or silicone in the middle. This product is probably a little more reproducible. It's made by Alexis and is a small gel point. The Gel Point Mini functions by having this gel dome to it. It has two insufflation ports. It is placed on a small wound protector retractor, and you can place the instruments through the gel at any position you want. So once again, only the trocars are going through the abdominal wall. In so doing so, you can see the remote center here, which is the dark lines. You could keep that incision in the abdomen to down to 1.2 to 1.5 centimeters overall. You might say, well, where do you put the accessory port? The accessory port hovers above that in the dome area, and you only pass the suction through or pull the needle up through that, and that way you don't need the trocar actually going through the abdomen. As you can see here, that's a 10 trocar in the dome of the gel point, but it's not inside the abdomen as you see here. And that suction irrigation or inline needle driver is only brought through in between those instruments when it's time to do suction irrigation or to remove a suture. You'll see the suction coming down through that small gap in the abdomen that we're trying to keep at 1.5 to 2 centimeters, and that's usually acceptable for patients with small umbilici. That allows them to hide that incision in the belly button. Reversal mega incisions and Z-plasty are not as effective as just a smaller incision, in my opinion. The Gel Point Mini is perfect because it's not too large of a footprint. It allows also an extraction point for tissue at the end. You can see the suction coming through without requiring the port to actually be in the abdomen, as you see here. I really saw no problems with manipulating and triangulation. I've done several cases with this technique, and the other added advantage is they have cut the price to not be expensive. And this allows us on smaller patients to use an alternative way to maintain cosmetic, nearly scarless surgery.